Hi, my name is Erin McMurtry, and I am one of the counselors for Open Doors for Lanark Children and Youth. Here to just give you a little bit of a snapshot of information about trauma. So, what is trauma? Trauma is an emotional response to a distressing event. It can continue to cause emotional and physical symptoms for many years, even after the event has concluded. Trauma harms a person's sense of safety, harms their sense of self, it contributes to feelings of shame, helplessness, powerlessness, and intense fear. It's really important to know and understand that trauma affects everyone differently. Um, so what my brain might perceive as traumatic and how I respond is different than the next person. Um, and it's really important to understand this. So some people can have, long-lasting effects of trauma, which we would call post-traumatic stress disorder, or PTSD, as you might have heard. Some people can have very resilient reactions to trauma, and some can experience only brief or episodic reactions to trauma. Certainly affects different parts of your brain. The parts of your brain that your amygdala, the part of your brain that is responsible for your fight, flight, or freeze response. Trauma has significant impacts on different parts of our brains. Common responses to trauma. So this is a brief list, and we'll just go through them. We could certainly add to the list. And again, it's important to note that it's not a list, meaning you're going to experience everything. Some people might only have one thing, some people might have multiple, and the list is far bigger than this. We could certainly add more. So re-experiencing trauma through nightmares or flashbacks, avoidance of trauma reminders, so avoiding people, places, things that are related to the trauma, or avoiding conversation about the trauma. Distressing thoughts, emotional distress, and physical responses, maybe migraines, stomach pain, withdrawing, depression and anxiety, sleeping and eating disturbances, risk-taking, recklessness, impulsivity, substance use, obviously as a way of coping with very intrusive thoughts and distressing emotions, strong feelings of shame, guilt, and embarrassment, memory loss, feelings of disconnection, quick to anger, aggression, irritability, difficulty concentrating, and wishing and focusing on revenge. So what can you do if you yourself have experienced trauma, or somebody you know is experiencing trauma or has experienced trauma, is to provide a safe, non-judgmental space to talk about the trauma, reassure that feelings of shame, guilt, and embarrassment are all normal, encourage and engage in meaningful and positive relationships with others, and to connect with your community resources for support. We have an abundance of wonderful resources right here in Lanark County that are able to support you with this. And you certainly don't have to navigate this alone. And I think that's really, really important for you to hear, that there's support out there for you.